Radiological Anatomy of the Brain, number 6, prepared by Prof. Sharaf and revised by Prof. Rami Edward. This is the anterior surface of the mesencephalon, showing the midbrain with the oculomotor nerve coming out and the trochlear nerve curving around, showing the trigeminal and showing the from 6 up down or up to 12 cranial nerves coming from the region of the medulla. Here is the section at the region of the pons of the midbrain, showing the oculomotor coming anteriorly. Here is the section at the pons, showing trigeminal nerve coming from anteriorly and to lateral side. And this is the region of the upper medulla, where there is still fourth ventricle with number 12 and number 10, vagus and hypoglossal. Then the medulla at a lower level with the central canal, showing the 8th nerve coming along the lateral side, and most of the cranial nerves are coming from the medulla, as we said before. This is the image for that. Here all of them are coming out along the lateral aspect, different levels. Now the cerebellum, we have the cerebellar hemispheres, and we have the connection between the cerebellum and the brain. Superiorly there is superior medullary velum, and this is the superior cerebellar peduncle, middle cerebellar peduncle, and inferior cerebellar peduncle, and thus we can say that cerebellar peduncles in general. This middle part is called the vermis and is composed of lobule, followed by lingula, followed by nodulus or nodule, and end by the uvula, and the uvula extends to the tonsils. So tonsils and uvula are considered almost similar structures. Inferiorly, you will find from the other side, inferiorly, you will find what is called tuber, pyramid, and nodule, and each is connected with the corresponding hemisphere. A sagittal view in MRI will show this is the pons and this is the medulla, and this is the cerebellar peduncle or the middle cerebellar peduncle, because it is the widest one. As you see here, it is the biggest one. So this connection to the anteriorly is called the middle cerebellar peduncle. Vessels, both arteries and veins, could be running in the subarachnoid space and penetrating, and these are called cortical vessels, different from that coming from the anterior and posterior cerebral circulations, carotid and vertebrals. And you should imagine that this is the bone, the periosteum of the bone is the dura, and then there is arachnoid layer, and the bea is the capsule of the brain, or something adherent to the brain. You cannot strip it off. While going inside, they can get some bea with it, and this space is called the arachnoid space, and in such an area, collections will give special appearance, while subdural will give another appearance and epidural will give a third appearance. So we have appearance depending on the attachment of the meninges with the corresponding or the nearby structure. Those related to the bone are periosteum and very difficult to be elevated, and this is the epidural. Between the periosteum and the arachnoid space is the subdural, and this is easily to be filled with blood, and that's we can get the concavo-convex configuration. And here is the subarachnoid, which can extend into the sulci and fissure. Here is the cavernous sinus, and we can see the carotid double outline because it is curved, and this is called the carotid siphon. Of course, this area here will be the medial end part of the hippocampus and called amygdala or amygdaloid. This is the optic tract, and this is hypophysis or the pituitary hypothalamus and infundibulum going to the pituitary, which is the scene present in the sella turcica. This will be the sphenoid sinus, and this will be the nasopharynx. Here this is the one to show that within this is the region of the third ventricle, and this is the massa intermedia, and this is the pineal body, and this is the habennular commissure. That's why calcification in this area will be round and curved, round and curved, habenula and pineal. This red one is the choroid plexus. This is the tectum of the midbrain with superior and inferior colliculi. Here we can see the cerebellum. Still there is choroid plexus in the fourth ventricle, and here is the midbrain, pons, medulla, basilar artery, and of course if you look here, this will be the tectum of the midbrain or the quadrigeminal plate with the colliculi. This one round here is the pineal, and this one curved is the habennular commissure, and this one will be the cisterna magna, and this is cervical one, and that one is the odontoid. Cerebral veins, we have two, an internal group and cortical group. This is the cortical group where the venous drainage of the bone is coming into the arachnoid space, subarachnoid space, I mean into the superior sagittal sinus. Arachnoid granulation are there to absorb as much as possible of CSF. This is the internal system composed of a superior sagittal, as well as inferior sagittal. Both are drained by the straight sinus into the transverse sinus, and then the sigmoid sinus going to the jugular bulb. Now what about the internal veins? This straight sinus is draining both superior sagittal, inferior sagittal, and vein of Galen. The vein of Galen is the one draining the internal veins inside here. Two internal cerebral veins, if you remember, we described it before a lot in the scans for the brain, and two basal veins. One is on this side and the other is the other side. It's called the basal veins of Rosenthal. So basal vein of Rosenthal and internal cerebral veins are draining into Galen, straight, transverse, sigmoid, and jugular bulb, while superior and inferior sagittal are draining into this confluence, and this is called the torcular hierophyllae, where all are gathered here together. This is a magnification view for the region of the vein of Galen, straight sinus, inferior, and the superior should be here somewhere. And this is the internal cerebral veins with the basal veins of Rosenthal. The internal cerebral veins are draining two small veins, what we call septal veins and thalamostriate. Septal and thalamostriate. So to make it more clear, from either side you have thalamostriate and septal gathering together to form the internal cerebral vein. Two internal cerebral veins and two basilar veins of Rosenthal are all collecting into the vein of Galen, into the straight sinus, and at the confluence here they give the transverse, and then the sigmoid, and then the jugular bulb. Another view from the surface of the brain. This is the superior sagittal sinus, and these are Tourland. Tourland is one of the famous veins on the surface here, and of course such big veins could result in subdural hemorrhage. That's why it is important to know about it. Now what is this? This is the ependyma invaginated into third and fourth ventricles, so producing what we call choroid plexus. Choroid plexus may be calcified as this one here. This is how CSF is flowing. If we start in the choroids, whether these choroids are in the fourth, in the lateral ventricles, in the third ventricle, so this one in the lateral on one side, this one is in the lateral in the other side, this one in the third, then foramen of Monro, then into the fourth ventricle, you can find again some choroid plexus, and then you have anterolateral and posterior foramina or roots, how CSF is passing. So anteriorly it can pass around in foramina of Luschka, while laterally and posteriorly it is going into foramina of Magendie. CSF as a whole is then drained into the surface of the brain in the granulation tissues, or what we call the arachnoid granulations. Now we have total of 150, but production is up to 600 milliliter in 24 hours. That means that this CSF is changed 4 times a day. Now CSF circulation, as we said, from choroid plexus in the two lateral, third and fourth, and then converge in the third ventricle through the foramen of Monro, from the lateral ventricle into the third, and from the third into the aqueduct of Sylvius, and then exit through Magendie and Luschka to the outer surface of the central nervous system, where it goes into the arachnoid granulation, draining into the superior sagittal sinus. This is the drawing of such circulation. This is the lateral ventricles, frontal, occipital, temporal. This is the third ventricle, one-third ventricle. This here, the foramina of Monro, and this is the location of the massa intermedia. Here is the aqueduct of Sylvius going to the fourth ventricle, then two exits anterior of Luschka and exits posterior of Magendie. Spinal canal. This going on the surface of the brain will go to the arachnoid granulation tissue on the surface of the brain to be drained into the superior sagittal sinus. Thank you.